Talks. Today we are joined by Jessica Rigutto, editorial board member for NED and a senior scientist at ETH Zürich. So Jessica, firstly, welcome and thank you for writing an expert review on this paper that we're looking at here on the database, a systematic review published in 2022 on the impacts of ultra-processed foods on maternal and child health. So you've spent some time writing this expert review that we're looking at here. Why should we read this paper? Why is this paper important?
Well, this paper really stood out to me. Well, firstly, thank you, Claire, for having me on today. This paper really stood out to me because, well, it's part of my research area, but really it's maternal and child health is such a critical area because we're talking about the health of the next generation. Now, the systematic review was very well written. It has a very robust methodology, and it's actually really easy to read. It's a good read, so I would recommend reading the full paper to everyone. Of interest in this area, so ultra-processed foods, we know this is becoming much more ubiquitous within the food system, and actually it's suggested that in countries like the UK, ultra-processed foods can actually take up to 75% of people's diets. 75%, I mean, that's quite incredible. So when we think about the contribution that this is making to dietary energy, vitamin and mineral intake, we also want to think about what the effects are. And there's been a lot of research done already in adults, but a lot less done in maternal and child health. And this is what the authors were trying to do within this systematic review, and to really summarize the literature for the reader. So we have papers looking at pregnancy, I think one paper looking at lactation, and then some papers looking at childhood. And actually what the authors did find that really there's a sparsity of research and literature in this area. So ultra-processed food consumption in pregnancy and lactation, this can have implications on gestational weight gain. So, too much weight gained during pregnancy, also management of indicators of glucose metabolism, so all the things that we might expect, but also then feelings of depression or sadness, and also an impact on the child outcomes, so neonatal outcomes. This can also be increased waist circumference, fat mass, neonatal adiposity, and of course we know that when children are starting life with an overweight, this actually can have quite profound implications then later on in life. But also ultra-processed foods were linked with things like dental caries as well, so dental health, and also respiratory diseases and wheezing. So really things to be borne in mind when, for example, when we have, as nutritional therapists, when we have clients who are pregnant or looking to become pregnant, we should be really thinking about looking very closely at the ultra-processed food contribution that is making within their diets.
Yeah, so really interesting. And if you think about this in terms of as you say, the health of the next generation and the impacts that's going to have on health budgets going forward, then this is something where an area where nutritional therapists can really engage in a very positive fashion.
Oh, absolutely. And I think it's actually worth pointing out that in this study, they used this thing called the NOVA classification. So the NOVA classification actually has, thank you, Claire, has these 4 food groups, which breaks down processed foods into these 4 groups. So they focused really on the ultra-processed foods. But I would actually also like to highlight with regard to processing that, we have to also consider that it's not always that bad. So yes, the ultra-processed food group does consider, ice cream, cookies, nuggets, burgers, things like this, which, aren't maybe the greatest food sources. But when we look to the left, to the processed foods, we can also see that maybe tinned sardines are considered as a processed food. And they're actually a very good source of essential fatty acids. They're very cheap, very easy to access, very easy to use. So I think it's important that when we read research like this, that things aren't always as black and white as the researchers then bring out. So I think also an important point.
Yeah, and I think that also sits really interestingly, doesn't it, in the current debate of the cost of living crisis. Whilst people are struggling to stretch their food budgets, then actually some of those foods that are sitting in the processed food classification can legitimately enter people's baskets as healthy foods where they're going to get good nutrition.
Absolutely. And this is again where the role of the nutritional therapist comes in. So I think that in clinic, what we really have to be doing is looking closely at people's diets and helping them make positive choices where it comes to processed foods. Because yes, it may be a little bit black and white when we consider this from the research and the literature, which of course it has to be because we have to draw the line somewhere. But when we want to help people to actually make the most of the budget that they have, to get the most from that budget in terms of nutrient content, then we can really help them to orientate themselves with respect to what we know about ultra-processed food consumption and how negative it can be for health, but where we can actually get the positive inputs from it. So all in all, I would recommend reading this paper and interpreting it from our perspective as nutritional therapists.
Fantastic, super interesting, Jessica. Thank you so much for sharing your insights.
Very welcome.
For those of you listening, you can read all about Jessica and how to connect with her on the Nutrition Evidence Database under the editorial board tab, and you can access the full expert review from Jessica on the database as well. Thank you so much for listening to this NED Talk brought to you by the Nutrition Evidence editorial team in partnership with BANT.